Before the president got the virus, he planned to campaign tomorrow in Wisconsin, which is in the middle of a worsening COVID crisis. That state is one of 29 where coronavirus cases are on the rise. Yesterday, Wisconsin reported its largest one-day increase in new cases, more than 2,800. Meg Oliver looks at how Wisconsin's hospitals are wrestling with the challenge.
Inside the ICU at Aspirus Hospital in Wausau, Wisconsin, the number of COVID patients is growing fast. Their health system saw a 30% jump in COVID patients in a single day, according to CEO Matthew Haywood.
That this is just the beginning of us having 2 or 3 months of this, and we got to get through this.
82% of all hospital beds in the state are full after new COVID cases more than doubled over the last month. Milwaukee County hospitals may need to use this alternate care facility at the nearby state fairgrounds if trends continue.
Right now, we can't live like we're back to the way things used to be. We can't afford to act like things are business as usual.
As cases rise across the Midwest, Ohio Governor Mike DeWine announced the results of a large antibody study on Thursday. It revealed millions of Ohioans likely remain vulnerable to infection and that herd immunity is a long way away.
So what we have to do is hang in there. We got to keep this virus low, and we wait for the vaccine to hit.
As several vaccine manufacturers continue critical work in phase 3 trials, some participants have developed side effects, including 53-year-old Lisa Majeski.
What have the side effects been like?
After the first injection, I just had some mild body aches for about half the day, and I just took some pain medication and I felt better. And after the second one, it was about a whole day of a low-grade fever and more severe body aches. And I took some more Advil and I felt fine the next day.
Any regrets?
No, none at all.
This is one of the testing sites for the Moderna vaccine at Hackensack University Medical Center. This week, we learned the CEO doesn't expect the vaccine to be widely available until next spring. And on Thursday, the CEO of Pfizer told employees they will continue to move at the speed of science with their vaccine and not bow to political pressure to move faster. Tony?
Meg, thank you very much. Well, there's certainly a lot to take in this morning as we wake up to the news of the president and the first lady testing positive. I'm stuck with the remark from Dr. David Agus looking at the numbers that in his age bracket with this diagnosis, there's about a 10% chance he could have serious complications.
Yeah, and as we've seen with other world leaders, Boris Johnson in particular,
was
initially
very ill.
Well, initially he wasn't. Initially everything seemed fine, and then he took a turn. So this, as we've pointed out over the last months, this virus acts differently with everybody.
Well, it's just another indication about how this virus does not discriminate. No one is immune from it. If the president of the United States can get it, who is that protected and that well covered, and that he gets it, it says a lot. I hope that they will be listening at the White House to what Major Garrett was saying about transparency. You really got to be very clear about when this happened, how this happened, and who has he been in contact with.
And
that's a lot of people.
It is, and at the scope of this, how far is not yet clear.
The world is watching and wondering.
And so many questions still remain that we don't know.
And as Boris Johnson said, this could go either way, he said, as he came out of intensive care.
That's right.
We'll be following whatever direction it goes.